breast data collection workflow. The following is an example of the breast data collection process. Again, this is an example. You have the autonomy to make adjustments to fit your clinic structure. So first, you should set a cadence to review clinic schedules to identify eligible breast patients. You can utilize consult notes, planning directives, or any other resources you have to determine eligibility. If a patient does not meet the eligibility criteria, there's no further data collection necessary. If a patient does meet eligibility criteria, you want to do the following. You want to meet with the patient to discuss MROC. This is a time where you can provide the MROC brochure to the patient. If the patient agrees to participate, you want to enroll the patient into the database and then facilitate the completion of the patient baseline or pre-treatment survey. And then you also want to make sure that the provider receives their first week survey, and you should complete your CDA baseline form. During the patient's last week of treatment, the provider end of treatment form should be completed along with the patient end of treatment form. The B6 form should be completed, and you should notify your physics team that the patient has ended treatment and they can go ahead and enter their information. You also want to make sure that the patient is scheduled for follow-up. If the patient declines to return for follow-up, this will be the time to enter a termination form. For follow-up, you want to again ensure that you're reviewing the schedule so you know when a patient is returning. When the patient returns, you want to just still make sure that they meet eligibility. If they no longer are eligible for the project, again, you want to submit the termination form and submit all required forms. Breast patients who are still eligible should complete their patient forms, provider forms should be completed, and if necessary, the B6 form should be updated.